Claire, how are you doing? Can you hear me and see me?
Ah, I can. How's it going?
Very, very good, thank you. Now that we're communicating, I'm very, very happy. I was slightly worried that Instagram wasn't going to work out for us.
Yeah, I don't know, was it my reception or your reception? But anyway, we seem to be good.
Okay, hopefully it works out. We'll get started. Would you do us the pleasure of introducing yourself, please?
Yeah, I'm Claire O'Donnell. I am a veterinary physiotherapist and I own the canine clinic up in Ducloyne Industrial Estate. So I qualified in the UK back in 2015, I'd say it was. And I worked in Glaby Veterinary Hospital for 5 years or so. And then I opened the canine clinic in 2020. So
Brilliant.
yeah, it's great.
Thank you so much for coming on and joining me. For anyone that doesn't know me, I'm Killian from Ruby Reese. We set up our business we launched our business almost 2 years ago. We'll be 2 years old in May. And we have a range of treats, home grooming products, and nutritional supplements. So, launching straight into the topic at hand this evening, we want to talk about hydrotherapy for dogs. Let's start off really, really basic and look at what even is hydrotherapy.
Hydrotherapy is literally simply using the properties of water to treat any injuries or dysfunction in the body. It's kind of heated to 32 degrees, so that helps with blood flow and things like that. But obviously, seeing as you're a client of mine, you know all about this with Ruby and the injuries that we treat and things like that. So yeah, I suppose, seeing as I'm a qualified physio, it kind of enhances my treatment that I would do on land. Mm-hmm. It just means I have like boiling water, the heat. I feel like it speeds up results a bit. And it also helps with kind of desensitizing dogs who might, if they're very painful and they don't want to be touched, it can help with that because they're surrounded by a body of water, which makes my job a bit easier. And yeah, it's just a really nice modality to use on top of, like electrotherapies that we use, like laser and pulsed electromagnetic therapy and manual therapies and things like that. I feel there's just so much, it's just so beneficial to a dog's recovery from, whatever reason they're in with us for.
Absolutely. And you mentioned, Ruby is a client of yours, so we're very, very in touch with what you do and very much believe in this as a therapy for certain conditions, definitely, certain dogs. But I suppose maybe for the person that has heard the word hydrotherapy for the first time, let's paint a picture of what it looks like. I mean, are they thinking about a huge swimming pool? Is the dog swimming all the time? What does that look like?
Yeah, so I suppose the pool is about 2 meters by 4 meters. So you've got a ramp going up into the pool, and you've got a ramp going around the whole pool. I'm in the water with the dog at all times. So this is kind of something that I believe in. I suppose a lot of vets would say, oh, just swim them in the lake or swim them in the sea and things like that. But the whole point of hydrotherapy with a therapist is that the therapist is in the water and it's basically shaping how the dog moves, assisting in different ways to enhance how the dog is moving or to target different muscle groups that the dog is disengaging and things like that. But I suppose what everyone thinks is that, oh, my dog swims and they love water and sure, of course, this is easy. But actually for a dog, it can be quite challenging to learn something new like this and obviously, bond with me or another person that's going to do a session with them. So there's actually a lot to it. One of the main things, I suppose, in how we would be trained is therapeutic handling and how we approach a dog and how we read a dog. So I suppose from the minute your dog walks in the door, I'm assessing how they're moving, how they're feeling, like the calming signals that they're showing me. When I touch their body, I'm looking at how they're responding to that. So I'm looking for areas of pain or areas where they're kind of saying, oh, that's not very nice. So the first session, it's basically a full assessment of the dog. We go through the home environment, what you do with the dog, and where in the home environment maybe slips or falls or things like that are happening that we could alter and just address those things, which might mean less vet visits, less visits to me, less pain for the dog. So the kind of first session is really important. shaping an idea of what the dog does every day. So like for you, it would be, you know, give me a day in the life of Ruby, and you know, and let's see like where the inflammation might be happening or where the injuries might be happening, things like that. Sometimes it's as simple as I've got really slippy floors and the dog keeps, you know, from the couch onto the floor, or you know, or you know, I think a lot of people, the dogs use the stairs, but yet maybe the dog can't use the stairs, you know, and you kind of need to be able to, I suppose, at a point in a dog's life, just kind of know what, you know, what's causing the dog pain and how we're going to address it as such. But yeah, so that's the first session. Really involves getting that picture of that, and then introducing the dog into the hydro room, wearing a harness. So some dogs aren't used to wearing a harness. Even walking up and down the ramp can be challenging for the dog. Different floors can be challenging for the dog. And then they're standing at the top of a pool thinking, okay, what the hell am I going to do now? You know, so there's a lot of trust involved, and there's a lot of, I suppose, skillful handling, because there's there's so many things that can go wrong with dog water, fear, if they're scared, you know. So, yeah, the first session we take it really handy. It takes about an hour. And we really go at the dog's pace. So, you know, reading, again, this is where knowing dogs' body language and behavior comes in, is that we're reading them and we're going at their pace. I mean, yes, they're going to be worried, but, you know, like the idea is that we get them in, even if it's just statically standing there, just letting them get used to things. We find out what they're motivated by. So it might be treats or toys or praise, and then we'll figure all that out. But yeah, the first session, it can be very interesting. It's hard to know what way it's going to go, you know.
Oh, like, definitely. And I love how all these talks kind of link together. We did a talk a couple of months back with Killian on pain management, and some of the things you're saying are kind of almost deja vu. You know, having a trained eye looking at dogs' behaviors and dogs' movements can be so valuable. I think it's often the case, and I'm sure you hear it as well quite a lot, is that my dog does this really funny thing, and that's normally like alarm bells. It's actually not a really cute thing that they do. It could potentially be a sign.
Totally. Like, oh, he sits with his leg out like this, but sure, he's always done it. But like, yeah, I mean, telltale sign of an issue. But I suppose that's where raising awareness and doing things like this comes in, is that people just don't know, like, you know, don't know that that's not normal. And because they're like, oh, I just saw other dogs do it, and that kind of thing. So yeah, it is important to kind of raise awareness and educate owners, I think, to kind of almost empower them. Like, so that's why the first session is important, because we will teach exercise plan as well. So there you're kind of empowering an owner to be able to kind of go home and say, okay, I've got 3 exercises to do that are really going to help my dog. Or, you know, I could put down a yoga mat where he keeps on slipping, or I could put up his food and water bowls. You know, there's really things that we can do to actually change posture, behavior, like loads of different things so easily. But yes, we just don't have the knowledge on it, or people didn't just, like, a lot of what I hear would be, oh, I just never thought of that, or, you know, that didn't even cross my mind. But it, like, so simple, like the solutions are actually very simple. So
exactly. And just I know I'm drilling down on the pool a bit, but so they're wearing a kind of a flotation aid when they're in the pool, and so the water in effect. Sorry,
there's no actual flotation in it, so they're just actually rubber harnesses. So I guess flotation harnesses simply so that they engage their core themselves. But like we're the support, like we're the flotation device as such if they need it. But actually, there's no flotation in the device itself. So they're just wearing a harness essentially so that we have a hold at all times from a safety point of view.
And then the whole idea really is based on the concept of them having a larger range of motion like we would have when we're swimming, and that I suppose it's low impact, right? It's not like going on a treadmill where you're kind of pounding on that knee or that hip. It's really, you know, kind of getting the flexibility in there and the full range of motion, right?
Totally. And like, I suppose, having the buoyancy of the water, having the heat from the water is another. Like, it makes my life a lot easier. The tissue gets softer a lot quicker, so I can do a lot of massage techniques and movement and manual therapies in the pool with. But ideally, you are trying to improve the range of motion and the range through. And again, lots of studies have proven all these things, you know. So I think sometimes we're kind of cast with the alternative therapy thing, when really it should be a multimodal approach when vets and things like that. Again, that's something that we're trying to obviously improve as well, you know, that it's thought of alongside like pain relief and medications and things like that rather than a last resort.
Yeah.
Um, yeah.
And I think it's interesting as well when you reframe it, particularly in Ireland, because you know, with Ruby, you know, doing hydrotherapy, we tend to explain it quite a lot, and the I think there's a certain type of Irish person that doesn't get it for dogs, and they think this is hilarious, that it's swimming lessons, which we kind of sometimes play up to. I'm sorry, but you know, if you say, but this has been done for decades with horses, with race horses, a certain type of Irish person, their brain switches to ear to the ground, because every year for about 10 years there was a session on horses doing hydrotherapy, right, in the big pools. So I think they had their annual outing there to do the filming there. So I think it just clicks for them when you say horses. So it's funny.
It's a no-brainer. Like, I mean, the results are amazing, and I suppose the nice, like when vets start to refer and then they start hearing back, you know, oh, the dog now doing, you know, the dog can jump into the car and he wasn't able to do that anymore, or he started toys again and he hasn't done that since, you know, 4 years ago, or you know, it's really lovely. Just come in with these they're just so ecstatic, and they're like, you know, or like they say, oh, you told me that, or they never recommended this. And I suppose that's again something that as an industry we need to really probably a bit more, is that like we are there and it does work. And the thing is, like, I suppose what worries me is when I'm like, even when I just walk down the marina and I'm looking at all these dogs, and they're all like, they're so crippled, and I'm so tempted just to be like, hi, you know, here's my card. But you know, the other thing as well is people get really upset that they may have missed signs of pain, or God, how could I not have seen it? But again, if you're not educated in it, and if the vet isn't telling you that this is pain, then sure, how are you meant to know, you know? So
Exactly. And I suppose let's maybe look at some of the types of ailment that could be treated or could be managed through something like hydrotherapy. So I know acutely from Ruby that luxating patella is something that can definitely be looked at. I presume things like hip dysplasia could be looked at.
Yeah.
I've heard arthritis mentioned a couple of times. So maybe you want to go through some of the things you see kind of quite typically.
Yeah. Okay, so as you said, luxating patellas, they seem to be doing really, really well actually. It's conservative. So yeah, that seems to be a nice one. The dysplasia, one of the main things I see. We're starting to see that a bit earlier on now with puppies. So people actually are starting to realize, like, oh, my puppy's not acting like a normal puppy, or he can't get into the car, or like things like so we actually are starting to see them a bit earlier, which is great. Because it's actually made a huge difference. Already it can even have, you know, if we kind of catch it young while they're developing. So we've got up to 15 months for them to be skeletal mature. Which means that, like, instead of them growing in pain and finding ways of compensating and managing that, we can actually teach them how to move properly and pain free. So like that's fun. And then like, you know, we always get the oldies, which do really well as well, and it's so rewarding. You know, these guys, I suppose, because these owners, when you're heading towards like later in life stages, and obviously the idea of them not being around for much longer, like, devastating. And then when the owners get maybe, I don't know, another year or two of good quality of life, like, you know, there's nothing more rewarding than that. So yeah, like that's a big thing. And I think as well, I always feel if the dog is, if the dog's going to be around, like the fact they need to be having a good quality of life, you know, it's not this thing of, oh, my dog's 17, but sure, he can walk from here, you know, like, good. So the oldies would be a big one. The geriatric, post-op is a big one as well. And I suppose it makes so much sense. It's like, if you had a hip replacement, you'd be getting physio, you know.
Absolutely.
You'd be yeah, it's again trying to get them even post-op, so that they've been in the pool, they're comfortable with it, and then after their surgery, that we can start as soon as the vet okays it. It also works really well. Shit disease, huge one. Dogs who've had TPLOs or TTAs, and people listening, have experienced that. That's a big one, and they do really, really well. We generally see them 4 weeks post-op, see them weekly till about 12 to 16 weeks after that. And as long as they're progressing, we tend to space out the sessions and see can they manage it. And as long as they're maintaining everything in between sessions, we just keep pushing it out. And, we might not see those dogs back again until they are geriatric,
Yes.
But the fact is that while they're recovering, it is really important to get them to move properly, to use it properly. Otherwise, what is the point of spending a fortune on these surgeries? So they'll be kind of our main ones. Elbows, a lot of lumbosacral issues. I think the cocker, all those ones, they end up with a bit of lumbosacral disease and things like that, hip dysplasia. So we're seeing a lot of those. But we'd have breeds of all types, sizes, all sizes, all breeds. But yeah, I mean, obviously, the Labrador with arthritis is the primary thing that comes through the door, just because they're, which naturally.
And now that you've mentioned the dogs that are suited, are there dogs that are not suited to hydrotherapy? I'm giving some examples here, like dogs during a pregnancy, dogs that might be in heat, dogs with open wounds. Are these situations where it probably isn't suitable? Are there others?
Yeah. So you mentioned a few. Yeah, dogs in heat just can't go in the pool while they're in heat. Dogs with open wounds, yeah, we'd avoid putting them in the pool. The pool has low levels of chlorine in it, obviously to kill any bacteria. So that, but generally, behaviorally, I suppose, and just simply because I've had 2 tricky German Shepherds recently, has kind of made me think about this. It's that we can't treat them, or we can't find ways to do this, to do the hydrotherapy and to get them on board with us. It just takes more time, and it takes a lot of patience, and it takes building up a bond. And I guess it's very dependent on if the owner is willing to allow the time, and has the time and the money and everything else, to kind of commit to saying, we are not rushing this dog into the. It takes 3 forward with that. And if they are, great, and if it doesn't work out, we're not going to force these dogs into they don't want. We're just going to have to find alternative ways. So some might be maybe managing their pain better with pain relief, or getting to do more at home because the dogs don't mind being handled by those people, or just doing land-based stuff. The other side of it, I have a pool, whereas there's a treadmill as well in Cork City. So if I think the treadmill would suit the dog better from less hands-on kind of idea, or just being less worried about it, then I'll send them over that way. Because you kind of just need to figure out what's best for the dog. And there's no point if the dog is extremely stressed therapeutically. I mean, it kind of defeats the purpose.
Absolutely.
So yeah, so it just kind of it's dependent on a couple of factors. But I'd never turn away a dog. So if they come and we on the first session assess the dog, and it's kind of okay, this could be a bit tricky, we'll give it time. We'll just give it time. And if it's not suitable for the dog, and if it's not fair, well, then we won't recommend it.
Yeah.
Jen?
Yeah.
Okay.
And you mentioned a couple of times already working with vets. So I kind of want to underline that one as well. You're not just a standalone therapy that's out there on its own. You're working kind of in collaboration with the whole community of, dog trainers, presumably, and vets, and the whole lot, right?
Yeah. So we work under veterinary referral. So there is a veterinary referral form that your vet needs to sign and fill out. And that's basically just so because as physios, we can't diagnose things, the vet has to diagnose it and refer it to us. So that we, I suppose, know what's coming. Because our treatments will differ. If a dog has a spine, there's a dog with the cruciate, you have to have why they're coming. And yeah, I suppose in the UK it is law that they have veterinary referral. In Ireland, it's just good practice. I suppose the worry for us as an industry that it's kind of like dog trainers and behaviourists. It's a very unregulated area. So I suppose that's again something that we all need to look at, just because we know how these things kind of can spiral. So yeah, so having a good relationship with the vet, and being able to go back and forth, I find it on this visit, or 4 sessions now, I'm not happy, I think they're still in pain. Can you take a look at that? So it is really nice to have a good relationship with the vet. And obviously some are more involved and some want to hear more feedback and independent, but yeah, it is really nice to do a kind of a collaborative thing, because there's so many ways that we can help dogs, and different things like that. So having vets on board is really important. Yeah.
And even from my perspective, or in this case the patient's perspective, it's also great because we to give full context on Ruby's story, she has luxating patella, which to some of you is a dodgy knee, I suppose. She was saved from a surgery basically through hydrotherapy and physiotherapy, and we know that we're going to be managing this conservatively for the rest of her life basically. She doesn't need the surgery right now. She does very, very well with it. She tends to get a flare up when she does something crazy, typically during Zoomies, and we're expecting this to happen kind of to be a week or 10 days, once or twice a year. And she doesn't need to go through the surgery for that. But working in a holistic sense as a patient, it's great because we can go to our vet and get anti-inflammatories, and we can book in with someone like Claire and get some hydrotherapy sessions sorted. And we know that combination is really, really going to work for Ruby. That might look different for a different dog and for a different different setup, and different working with different issues, and for treating different things. But from a patient perspective as well, it's great to have everyone kind of working together as well on the one issue. And I suppose, as we were talking about misconceptions already, are there any other misconceptions that we haven't touched on that you'd like to clear up?
Misconceptions. I think the main one is that just take the dog to the river, same thing, because it's not. Yeah. Yeah, when I think of all my training, that one really gets me. Misconceptions otherwise, I'm not so sure. I think people underestimate how much it kind of takes for the dog to do mentally and physically. And I think like I always try and say, look, it's kind of like doing an exam, or like they something completely new and it's out of their routine. They learn, okay, this is how I do it and this is what I do next, and then this girl is not so bad, and it becomes really easy for them. But for the first couple of sessions, they're exhausted. Like they go home and they're absolutely wrecked from it. So I think people are kind of like, oh my god, she slept all night, or that kind of thing. So yeah, I think people underestimate that it is a challenge for the dog, regardless of swimming or not.
Yes.
And they also, the other thing I say is, like, the other nice things that would be like dogs who are like really kind of nervous or anxious. Like I think maybe doing this, and also so some sessions owners come in the beginning, we kind of tend not to bring them in just because they're like children, and it just makes the session that bit more difficult, and it takes from it being about the dog. So when they start away from the owner, do this thing that they become really good at and start achieving something, they end up just like so full of confidence. Like I had a lady whose dog used to like run the lead and used to hide in its kennel outside and would not come out. And then after a couple of sessions, she was like, she's like a different dog. Like she doesn't hide in her kennel anymore, or those kind of things. So as regards misconceptions, I'm not sure. I think that it being the same as swimming in the sea and the lake, is, I hear that a lot.
Yeah.
I think people are surprised that I'm with them at all times as well. And I suppose the level of like safety that we would have, and like I think maybe people think, oh, just throw another one, actually throwing toys. We don't actually let them take the toys off the water line. That can be dangerous from like a water intoxication. So I suppose the misconception that we're going to be throwing toys, crack and fun and screaming and laughing, but actually it's more, imagine going into a spa. I think it's a certain therapeutic approach. It's therapy, it's not fun. And that's the kind of the approach, rather that like, oh, well, if you just like scream and get him excited, he'll be all about going into the pool, but that really isn't what it's about. Yeah, so there's a couple of those kind of
definitely. And I think people would take it a lot more seriously if they could see the results that we and many of your other patients have seen.
Yeah.
So that's so valid. And do you think hydrotherapy is becoming more common as a treatment in Ireland? And maybe with focusing in on Ireland, how do we measure up in comparison to other countries?
It definitely is. It's definitely coming on, for sure. Simply because, like, well, the amount of, like, we have a physiotherapy group, and the amount of physios that are coming into that, since I started, is huge. I also do like a practical side for a hydrotherapy course through the UK, and the interest in that is huge. So like, it's definitely there. People are aware of it now, and people are really wanting to be part of it. So lovely. Standards wise, I think, as I said before about the bit unregulated, only worry. And I suppose that, like, realizing that, I suppose if your dog is, that you research it, find out their qualifications, would be important. They do get in and out of the treadmill with the dog or not. And just, I suppose, yeah, the level is really important, because if you have a bird and like I take the dog away for 45, the last thing you want is for me to re-injure the dog, or like, you know, not be trained in like predicting things that can go wrong, you know.
Absolutely.
Dogs who like, I have to stop them from the pool because they're so excited, or, you know, do these after the pool because, you know, you see a dog, you know the way dogs act after coming to see or something. It's like pure adrenaline, and they want to rub themselves up that. So it is really about being on the ball, and like it's mainly dynamic risk assessment that you're doing. You're kind of constantly like, okay, where could this go wrong? The dog, you have to be ahead. So there's a lot to it, and I think that's probably underestimated as well. Like, oh, sure, she's just putting the dog in the pool. Like, how there's a lot going on, and I think, yeah, it would worry me if the standard isn't there. Well, then definitely you can do a lot of damage to the dog.
Absolutely. It's definitely something to take seriously. And I love to see all the success stories coming in here in the comments as well. People are sending all their love and success stories in. If you're watching in live, you can check them out in the comments. But Claire, are there any success stories that stand out to you at the moment, putting you on the spot?
Yeah, there's loads. I mean, so I suppose we all kind of think of like the big ones. Or, I mean, who's on my page, she was obviously a big one. On months and months, hit by a car. She was three-legged, ended up having surgery, still three-legged, wouldn't use her leg. And I know they say, like, don't take your work home with you, and I took her home for 2 weeks, and I used to get her into the pool every day, and I used to work on her every night. And eventually 2 weeks later, she did use her leg, and she has been since, and she's, you know, staying on a farm now down in Kerry. So like that, those kind of things are huge, especially when that dog was in pain so long. It just proves, like, doing the right things and, you know, consistent, like doing the things, it works. It absolutely works. And then of course, like, success, like, take just the basic, like, you know, my old dog, he was stiff down and now he jumps up again, or the playing with toys again. Definitely gets me. Yeah. Now, like, when I worked in, there would have been more dramatic stories where, you know, knocked down, had like loads and loads of surgeries, and now like we come in to try and help them actually move again. So I suppose proof of, like, post rehabilitation, like, it's so necessary, and I guess unless you've got a physio, like, in a environment, it's very hard that's happening. So I guess if your dog does go for surgery, or, you know, any of the things we like down or all those things, they do need to be getting rehabilitation. Otherwise, in their body properly, or it will come again in the future when they're older, you know.
Yeah, absolutely. And it is amazing, I suppose, like you say, every story is a success story in itself, you know, the giving some extra life back to dogs, you know, letting them actually live. the way they're supposed to, and taking away some of that pain is just absolutely fantastic.
Like it's not just like, it's great obviously seeing the dog bounce in the door, but like the happiness that the owner is feeling because like got their dog back, or like it's like I'm very lucky. Like I obviously have the best job in the world, but from both sides, the owner and the dog aspect of things, like it's really rewarding.
I can imagine it. Yeah, absolutely. Thank you. Keep doing what you do. It's absolutely fantastic. How can people find out more if they're interested? I know that your Instagram handle is here, but it's at the Canine Clinic. They can also check out your website, I guess, and get in touch with you that way if they have any questions, right?
Yeah. More the merrier. Everyone's welcome. Yeah, to get in touch.
Brilliant. Thank you so much for coming on and sharing, Claire. The time has absolutely flown. It's been such a pleasure speaking with you, and thank you once again.
Cheers. Thanks, Gillian.
Thanks. Have a great evening.
You too. Bye-bye.
Thank you.